And in the Trump administration releasing a bombshell report on the nation's health. It's from the commission led by Health and Human Services Secretary Robert F. Kennedy Jr. And it does warn that processed foods, chemicals, and overmedication could be factors of chronic illness in America's children. NewsNation's Elizabeth Prann has been tracking this one closely for us. Elizabeth, good morning to you. What else did that commission find?
Well, we combed through it, Markie. It's about 73 pages, and you mentioned Secretary Kennedy does serve as the chairman and basically says that this report is a diagnosis, and over the next 100 days, the commission will work to treat what essentially they're saying is a generation of young, sick Americans. So 4 major factors that the commission points to. They point to diet, they point to environmental chemicals, they report to reduced activity, increased stress in young people, and over-medication. And they do have evidence in this report. So teenage depression has doubled from 2009 to 2019. More than 1 in 5 over the age of 6 are considered obese. A startling 1 in 31 are diagnosed with autism by the age of 8. And childhood cancer has spiked 40% since 1975. Another big piece of evidence is life expectancy. It's lagging behind other high-income countries. And basically, Secretary Kennedy says that's a national security issue because if you have chronic illness in young people, there's not the ability to have military readiness. Here he is.
It's common sense that ultra-processed, nutrient-poor food contributes to chronic disease. It's common sense that exercise and healthy food should come before prescriptions and surgery.
As you know, Secretary Kennedy has been working with the FDA to phase out 8 synthetic dyes, but the report does say they want to reduce prescription medication in young people, dependency on fluoride, look into vaccination administration, and then they want to report these solutions to the American people come August. Markie?
He makes some fair points when he raises them. What's the solution here, Elizabeth? And also, what are critics saying?
Well, that's a great question. There's a big shift right out of the gate when it comes to diet. So less emphasis on really ultra-processed foods, more emphasis on fruits and vegetables. That being said, they also want to look into pesticides and GMOs. The critics say, listen, you know, there's overemphasis on some of these, or they oversimplify some of these very complex issues. Some of the claims they say are baseless, let's say when it comes to vaccines. And others are saying that they're not going far enough, especially when it comes to pesticides and GMOs. We did hear from Zen Honeycutt. She was on NewsNation. She's on director of Moms Across America, and she spoke specifically to NewsNation about those pesticides.
Yeah, well, I was thrilled that they mentioned glyphosate and atrazine, but they also said, you know, 90% of the food samples tested are, you know, meet maximum residue levels. And so basically, you know, there's not a lot of pesticides in the food. That's actually not accurate because they're only testing for a couple of like 2 or 3 of the top 25 most widely used pesticides.
We also did some digging into the support of the MAHA movement. If you look at YouGov polling, it seems to fall up and down party lines. But when it comes to specifically food additives or pesticides, Markie, that really does have bipartisan support.
Yeah, it does make you think how you're fueling yourself and also your family. Elizabeth Prann, thanks for coming through that lengthy report for us. Appreciate it.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.